to themselves. Um, so, Miriam, I'm going to hand over to you for a quick introduction.
Thank you, Navina. Good evening, all. My name is Miriam Parry, and I'm Parkinson's disease nurse specialist, and I'm working at King's College Hospital in London.
Great, thank you, Miriam. Fiona.
Good evening, everybody. My name is Fiona Lindop, and I'm a specialist physiotherapist working as part of a multidisciplinary team in Derby.
Thank you. Ali.
Hello, I'm Ali Turnbull. I've been living with and managing Parkinson's for nearly 6 years. I live in Suffolk, and I'm looking forward to telling you all about it.
Thanks, Ali. And Ros.
Hi, I'm Rosalind Kent, or Ros is fine. I'm a local advisor and a helpline advisor for Parkinson's UK. I live in Kent, so I'm around that region, but the helpline is UK-wide.
Thank you. We'll get to know everyone a bit more, so I'm going to dive into our agenda. So, Miriam, first question is for you. Could you tell us what the role of a Parkinson's nurse is?
Thank you. As you all may be aware, Parkinson's disease is a progressive neurological condition that affects movement, and the managing requires a multidisciplinary approach. And one of the key figures in this approach is the Parkinson's nurse. The Parkinson's nurse is often one of the first point of contact for the individual with Parkinson's disease. And their role include in providing people with Parkinson's disease and their family and friends with essential information about the condition, its symptoms, treatment option, and what to expect in the future. It's helping the individual feel more empowered to manage their condition. They also help with symptom management and monitoring. So the disease can cause wide range of symptoms, including motor symptoms as well as non-motor symptoms. And the Parkinson's nurses are trained to monitor these symptoms closely and work with a broader healthcare team to adjust the treatment plan that individual will need. They're also addressing medication management, and one of our critical role is to ensure that you are taking the right medication prescribed for you correctly at the right time, and also help you to monitor side effects of this treatment. And the treatment can be complex. As such, it really is important to provide this monitoring and get that right balance is essential in terms of the treatment versus a side effect. And essentially, we want to see good response to the medication. As a nurse specialist, we coordinate in care, and we play a key role in coordinating the care between different disciplines. And often we liaison between neurologists, physiotherapists, speech and language therapists, and other specialists, ensuring that you receive a comprehensive care that is tailored for you as individual with Parkinson's disease. Finally, we also advocate for you and looking after your emotional well-being along with support. And we advocate for you, ensuring that you have access to the necessary resources, community support group, and appropriate services. So I can summarize that the Parkinson's nurse is a vital member of the healthcare team who helps guide you family and friends through this complex condition in managing your symptoms. So we provide education, symptom management, medication coordination, emotional support, and overall care coordination.
Thanks so much, Miriam. Obviously, the Parkinson's nurse does a lot for people. Ros, after being diagnosed, does someone automatically get referred to a Parkinson's nurse, or is there a different referral system for people? You're on mute, Ros.
Sorry about that. It said it was not on mute for a minute. Sorry. Yes, so every area can be a little bit different, and there are obviously issues that arise, but typically after a diagnosis, your consultant would normally refer you to a Parkinson's nurse. Sometimes, depending on area and situation, your GP might refer you once they've been informed that you've got Parkinson's. If you start on Parkinson's medication straight away, then you should be definitely being referred to that Parkinson's nurse. And times then when you may see them may vary, but some areas 6 weeks, a month or so. The purpose would be to see how your medication's doing, how you're getting on with it, and to do any tweaks that might be made necessary. But as I said, in practice, it doesn't always work that smoothly. And also, if you're not starting medication straight away, which some people choose not to, or they don't feel they need it right then, you may not then be referred to that Parkinson's nurse straight away. It may be partly more when you are actually on medication. But that is something that we on the helpline and at Parkinson's UK can sometimes assist with. So if you haven't heard from your nurse and you think you should, or you want to hear from your local nurse or find out who your local nurse is, then if you call our helpline, we can look into this for you. And we can also, if there are issues and you don't seem to be in the system properly, we can get our local advisor in your area who will have contact with the Parkinson's nurses, with secretaries, with all kinds of useful people who can find out what's going on, where you are on the list, if you're on the list, and get you there if you're not already.
Thanks, Ros. And also, what about people who may have been diagnosed privately? Is there a different process for them?
Yeah, so we are hearing a lot of people going privately now just because waiting lists UK-wide seem to be, very lengthy. Some areas just unreasonably lengthy. So some people are having to go private even when they really don't want to. If you have gone privately, there are not, I don't believe, any private Parkinson's nurses. I think there may be one or two throughout the country. So the process would really be that as when you're being seen privately, you wouldn't necessarily have access to a Parkinson's nurse. I know in some areas we can contact the local nurse and see if they're able to take them on, but I think that's definitely not a definite in all areas. So we do find some people are going privately at least to get a diagnosis and see where they stand, and then getting back on the NHS list so that they can access all these different services, Parkinson's nurse and other health professionals via the NHS.
Thank you. Miriam, going back to you, obviously the Parkinson's nurse and obviously specialist physiotherapists are core people that people with Parkinson's will probably be seeing. But what other health professionals are that people with Parkinson's might be seeing?
Well, people with Parkinson's disease will be referred to a variety of healthcare professionals to manage the symptoms and improve the quality of life. And this will be tailored to each individual personally. The key healthcare professional most commonly involved in the care of individuals with Parkinson's disease will be the neurologist or geriatrician. They are under the Parkinson's nurse, physiotherapist, the pharmacist that they go to get the medication for, whether in hospital or in the community, occupational therapists, and there will be other health professional that they'll be referred to. But again, this will be tailored to the individual personally, whether one will need a refer to see a dietitian or a psychologist or psychiatrist or a social worker and so on. But essentially, at the beginning of the journey with Parkinson's disease, one will see the main key member, which are the medical team involving the neurologist, geriatrician, Parkinson's nurse, almost definitely physiotherapists and speech and language therapists, and the rest will be planned according to the needs.
Thank you. And Fiona, you mentioned that you were part of a multidisciplinary team where you work. Miriam, could you tell us what a multidisciplinary team is, and how having a multidisciplinary team may differ from just having access to health professionals?
Multidisciplinary team is a group of healthcare professionals from different specialities who work together to provide a comprehensive care for people with Parkinson's disease and in other specialities. The team may include, as I mentioned before, doctors, nurses, therapists, social worker, and other specialists, all collaborating to create a treatment plan that address all aspects of a patient's health. And the key difference between a multidisciplinary team and just having access to individual health professional is the collaborative, holistic approach to that treatment plan. And in MDT, professionals share their expertise, discuss cases collaboratively, and coordinate care, ensuring that all patient needs are met in integrated way. And this is in contrast to seeing individual health professionals separately that do not communicate with each other.
Thank you. And Miriam, Fiona, you work with different teams. So Fiona, how might you interact with different health professionals where you work?
I work very closely with a number of different professionals, so particularly with the occupational therapist and the speech and language therapist. And that, although that's part of the core team, we have a number of other professionals within the team. We have a nurse who specialises in continence. She's not a Parkinson's nurse specialist, but she's a nurse with an interest in Parkinson's. We also work with the Parkinson's nurses and the geriatricians who see the patients who are usually over 60. Those geriatricians specialise in Parkinson's as well, and the neurologists. Also, we have a clinical psychologist, and we have a psychiatrist, and we have a palliative care consultant who's kind of looking at people who have had Parkinson's for many, many, many years, or who have an atypical condition where they need a bit longer to have conversations about their symptoms and things. So we have quite a wide team with a number of different physiotherapists, occupational therapists, speech therapists, and other technical support workers as well. And we have volunteers coming in from the Parkinson's community to come and support the clinics. So it's wide-ranging and, as Miriam says, very integrated and collaborative.
Thank you. And Miriam, what about you? Obviously, you work at King's, so how does it differ for you?
So with all different disciplines in multidisciplinary team, a regular meeting is taking place to ensure that all professionals are sharing and updating and adjusting treatment plan as needed for that individual with Parkinson's disease. So all of this interaction, effective communication is a key to ensuring that all team members understand the patient needs and goals, and all leading to a better outcome.
Thank you. Ali, we'll come to you now. Could you tell us when you were diagnosed with Parkinson's? Oh, can you hear me, Ali? I think you're on mute there. the mute button has bested us all.
Shortcut to it. Okay, let's go.
Yep.
Yeah, my GP referred me at the beginning of 2019, June 2019, but my first appointment in hospital wasn't till the end of August, and that seemed like ages to me. It stretched out ahead, but I know that people have to sometimes have to wait much longer.
And you mentioned you had a wait. Which health professionals did you see after that wait?
Well, once I was in the system, I was referred for appointments with the neurophysiotherapist and the Parkinson's nurse, but they were in the next diary. They were both a long way off. So there's still a long wait.
I think that's something that's seen quite a lot. And depending on where you live, it will really differ in how long you're waiting. Ros, obviously you've mentioned our helpline already, but how can our helpline and local advisors help people if they have questions about healthcare services or are struggling to access any healthcare professionals?
Yeah, so I mean, the helpline and all the local advisors have got a wealth of information and advice about healthcare services that are all relevant to people with Parkinson's. So when people ring us, we can either just provide straightforward advice, information about the roles that all these different medical professionals are going to be playing, the consultants, the Parkinson's nurses, which obviously we've already heard from, the role of the GP, speech and language therapy, physios, dietitians, occupational therapists, and mental health teams, and even pharmacists. So we can discuss what each role can provide, how they interact with each other, and how referrals and subsequent appointments are supposed to go. And then we obviously have a lot of people having trouble with all those referral processes, things not working as well as they should be. So if people are having trouble accessing services, hitting brick walls with referrals, then we can advise on, again, how it is meant to work. Whereas some areas, for instance, Parkinson's nurses might need a GP referral. A consultant might not do that, and it might be up to the GP. And we find sometimes the GPs don't seem to know that, or they perhaps haven't been through that process themselves before. So we can assist with that. If a person, needs us to actually get involved, we'll get our local person in their area to sort of contact. We do contact GPs on people's behalves, and we obviously contact Parkinson's nurses and other medical members of the Parkinson's team on their behalf. So yeah, the local advisor can do all of that kind of thing. And also referrals to other teams such as speech and language, physio, all that sort of thing. We can tell them how to do that and find the best route for them too. So they also know if there are going to be any problems or delays in their area, because unfortunately some areas either don't have a Parkinson's nurse or a reduced service, or there might be some issues that are really arising. So we can at least then manage that person's expectations of when they might be seen. We can sometimes ask a nurse if there is a cancellation. If someone is, really needing to be seen, we can discuss that with a local nurse and try and help that way. So it is always worth asking us about those things. We can also give advice on private healthcare, as we're aware, as we mentioned earlier, of all the long waiting lists around the country. We've just got basic advice on how to find a private consultant, what the process might be, general information around that. And yeah, although we don't want people to have to go privately, sometimes that feels like their only option. So we're just there to support them through that. And then, obviously advise them to try and get back on that NHS list, no matter how long the wait.
Great, thank you. And obviously, you've spoken a lot there about the helpline and local advisors and what they can do to help regarding healthcare services, but they can also help with a whole load of other areas, such as benefits and emotional support as well. So just wanted to raise awareness of that.
Yeah, we get a wide variety of queries. It's
Yeah.
definitely not all just about the healthcare, and we do get some very unusual questions on the helpline. But yeah, we're here to help with sort of holistically with the whole thing. As like you said, benefits, help from social care, local support, local groups, anything that will be useful to the person with Parkinson's or their families.
Thank you. All right, moving on to you, Fiona, then. So, as a specialist physiotherapist for Parkinson's, what symptoms can you help with, and when should someone with Parkinson's see you?
Well, to answer the second part of the question first, I think they should see a physiotherapist as soon as possible, because one of the most important things is for people to be as active as possible. And exercise, there's lots and lots of evidence that exercise can make the biggest difference to the Parkinson's symptoms. So part of the physio's role is to help people find the way to exercise, find out what they actually might need targeting. So our job is also to help with things like walking. If somebody's having any problems with their walking, sometimes people experience something called freezing, where their feet feel like they're glued to the floor. And there are a lot of tips we can give people to overcome that freezing. We can help people if they're having trouble with their balance responses. Often posture will change very subtly without people noticing. So we can measure that very early on and give some specific exercises to maintain posture in the best possible position. And we can also help with things that can become a bit tricky. So getting out of bed or getting out of a really low chair, something you used to be able to do easily, sometimes becomes a bit more difficult, mainly because it's something that you used to do without thinking about it. It's an automatic process, and it's the automatic processes that are affected in Parkinson's. So we can teach a strategy to get you out of bed again easily, or to get you out of a chair, because your ability to do it is still there. It's the automatic processing that isn't. So a physiotherapist can help with all of that, and also with just getting your exercise levels up and giving you a personalized exercise program.
Thank you. And we'll talk about exercise in a minute. But before we do that, could you explain what a set of appointments might look like with you?
Yeah. So the first appointment will usually be a longer one for all physiotherapists, where they're giving you an assessment. And at that assessment, they will look at all those aspects that I've just mentioned and find out from you what your biggest problem is, and then address that from your biggest problem outwards, really picking up anything else that they spot that they can advise you with. And then with you will together agree what goals you want to make, and then from that a program of exercise personalized to you can be developed or advised. The physio will also perhaps give advice about what's on locally that you can go to. There might be walking football or running football, or there are lots of specific Parkinson's sports things out there that might be local to you. But they can advise on what might particularly help your issues. We try to look at everybody very holistically. And so somebody might have 6 appointments, one a week, to do a particular exercise program. They might go to a high intensity class, or they might go to something that's not quite so high intensity if that's an issue for them at the moment. Whatever that person needs, we'll try and target them and help signpost them to the right kind of exercise for them.
Great, thank you. And there is so much of a push on physical activity for Parkinson's. Can you tell us why and what benefit physical activity has?
Yes, well, the why is because there's so much evidence that it makes a big difference. It can help so many of the symptoms, not just the motor symptoms, the symptoms that are about movement, but also the non-motor symptoms. So you might be surprised that it can actually help sleep, it can help apathy, it can help fatigue. So you do need a physiotherapist to help advise that, so that you get the right balance, so that you don't over fatigue, but you can actually make the fatigue better, can help with mood as well. So there is an abundance of evidence that has come about really in the last 15 to 20 years. Before that, we didn't have very much, but we have so much. And it's showing that different types of exercise are needed. So no one on its own is enough. You need to be targeting different types of exercise, and things like aerobic exercise makes a big difference. It can also help with new blood vessels in the brain and improve the connections in the brain. So we can't yet prove that it could slow down your Parkinson's, but it does perhaps point in that direction that it might. So it's definitely worth doing.
Thank you, Fiona. And we've had a question in the chat, which is there anything specifically that helps with tremor? And anecdotally, we hear that exercise can do that for tremor. Um, so, Ali, I'm going to come to you now. And
Okay.
before I ask you about what exercise you do, because I know you're a very big advocate for it, I'll ask you what your experience with accessing physiotherapy services was like and the impact that it's had for you.
Thank you. Well, I wasn't prepared to wait 5 months for a physio appointment. My GP had told me that it was important to keep moving, but she hadn't told me how. Fortunately, I had a friend in the next street with 10 years' experience of Parkinson's. She gave me a lot of positive links and resources about the types and benefits of exercise and went through them in great detail. I signed up for a 10-week physio-led online challenge, which was a great introduction to Parkinson's exercise. It got me thinking about big, powerful movements that help to rewire the brain. A local fitness instructor took me out Nordic walking and persuaded me to try kickboxing, which I still do. Both of these helped me with my gait and balance and helped me to strengthen my weaker left side. So 5 months later, when I strolled confidently into the clinic, I felt a bit of a fraud because I could see in the busy waiting room that there were people far worse off than I was, not just with Parkinson's, but there was stroke and head injury. There were other patients. And all the physio could really do for me was reassure me that I was doing these exercises properly. And then lockdown ruled out any face-to-face contact with health professionals and meant that I didn't actually meet my Parkinson's nurse in person until January 2022. By the time the physio could see patients again, there was a backlog in which all the newer patients took priority.
Thanks, Sally. Well, I know that you've kept up with the exercise and the information that you learnt from your physiotherapist when you saw them. Can you tell us about what physical activity you take part in and how have you found it helps you?
Well, I love being outdoors and on my feet, walking, running, orienteering. Indoors, I still box and I have a rowing machine in the garage. And I've just recently started Tai Chi. At the moment, it's a bit of a confusion of tigers and monkeys, and I haven't a clue what's going on. But I'm on my feet balancing for an hour in which I completely forget I have Parkinson's. And it's all meeting up with a lovely bunch of people, and they haven't a clue what's going on either. And that's a mainstream activity. It's not Parkinson's specific. But what underpins everything else I do is an online high-intensity workout twice a week. It's in small Zoom classes, no more than 12. We do those big, powerful movements and we work really hard. Excuse me. The vital component of this is real-time feedback for the instructors who are all qualified, experienced neurophysios. If we're not giving it enough welly or if we're not in the right position, they'll let us know. And that may sound terrifying, but it's also great fun. I pay for these classes, but there are community funds available to help people who can't afford this. So how does this help? Well, first of all, I'm still standing nearly 6 years later. I'm still slow, but I've improved in all areas of fitness, particularly balance and core strength. My left side is now as strong as my right. I've got a long, strong, confident stride, and I can still get around the park run. Don't look at the watch, but I can still get around it. And I've only had 2 falls in nearly 6 years. And as for mental benefits, well, I've built up confidence, met some amazing people, and laughed a lot.
Thanks, Sally. And obviously, some people may have done exercise before being diagnosed with Parkinson's. Some people may not have much experience with it. But what would your message be to someone about physical activity and Parkinson's if they've just been newly diagnosed?
Well, as my general practitioner said, keep moving. It's to find an activity you enjoy at a time, a place, and a pace that suits you. That doesn't always work out because the appointment might not come when you can do it, or the instructor, especially in a rural area, getting people into a village hall to do one activity at a particular time of day, it can be very complicated. And but try and get something that you enjoy most important, and focus on those big, powerful movements. Look at the Parkinson's UK YouTube channel. It's a great place to start. And drink lots of water.
Thanks, Sally. Fiona, what can people who are newly diagnosed do themselves at home, even if they're not experiencing symptoms yet?
Well, the most important thing is to keep moving, as Ali says, and to be staying active, to try to get outside every day, and to try and get a little bit out of breath. It's important to not remain in a comfort zone, but to just push yourself a little bit. So if somebody is already exercising, are you comfortable in that exercise? Is there something more you could do? If you're not exercising, could you, if you enjoy walking, could you walk a little bit more quickly from one lamppost to the next, just to get a little bit out of breath? Anything that you can do that just pushes yourself a little bit more will help. If you're not already exercising, trying to do something that's, instead of being sedentary. If you drive to the supermarket, we all tend to try and park as close as we can to the door. How about parking as far away from the door as you can, and then having a nice brisk walk to the door, or something like that, where you just have to put yourself out a little bit more to get a bit more activity and exercise. I think, as Ali says, find something you like. It needs to be something that gives you pleasure and joy and is fun.
Thanks, Fiona. And final question for you at the moment. But what are the differences between a physiotherapist, an exercise professional, and an occupational therapist?
Okay. Well, a physiotherapist can assess all those other areas of gait, balance, posture, and your transfers and things, whereas an exercise professional will focus on an exercise program. The physiotherapist can give you an exercise program too, but an exercise professional is more likely to be based at a gym or somewhere like that, and they can give you a targeted exercise program. There are quite a lot of exercise professionals who are specializing in Parkinson's, and know the kind of exercises to teach you. But it will be specifically exercise, whereas the physiotherapist has a broader approach to other problems. And an occupational therapist is somebody who can actually address a lot of those non-motor symptoms. So they, the ones that I work with do fatigue management. They help with sleep, because sleep is often affected in Parkinson's. So they can help somebody's sleep improve. They can help with mood. They can help with things like aids and adaptations if anybody needs them, which is often what people think of with an occupational therapist. Things like particular pen. If you've got tremor, it might be more difficult getting a pen that's comfortable in your hands, and they've got different types of pen they can advise on. And cutlery. One of the pieces of advice the occupational therapist I work with says is always ask for a steak knife. It just makes it easier. So it's about trying to make life as easy as possible and as normal as possible. They can also help with workplace situations, so they can support with if your workplace needs some adaptation, or you need to talk to your managers about the way your hours are or your job role. The occupational therapist can support in that.
Thank you so much. Before I move on, I just want to address one of the questions, which is about speech and language therapy. So we've had someone who's asked about choking, and this can happen with Parkinson's the further along you get. But maybe Fiona, could you say a bit about the speech and language therapists you work with and how they can help with choking?
Yeah. So our speech and language therapist deals with speech as well as swallowing. And if you're starting to have problems where you're coughing when you're eating or drinking, they can do an assessment to see how your swallow is, whether it's slightly delayed or not, and whether there's a risk of some of the food or drink that you're taking in going into your lungs instead of down the other way. And then they can advise on whether or not whether you should avoid certain types of food. Often steak can be difficult to get down. So they can give you lots of advice on foodstuffs to avoid or to adapt. And they can also help with your voice if it's quieter, or if you're struggling with word finding. So it's really all about communication and safe swallowing.
Thank you, Fiona. And we'll try get some more information to the person who's asked that question as well. Right, before I move on, I know we spoke about the multidisciplinary team, and we've had a question. Does everyone with Parkinson's have access to a multidisciplinary team? Um, and I think we can safely say the answer is no, as different services are set up differently everywhere. Um, a multidisciplinary team is kind of the gold standard that we want everyone to be working to, but at the moment we're not there. Um, so that's just answering that question. But Rosalind, I'm going to move on to ask you, but what information do we have about healthcare professionals? And do we have any tips for accessing them?
Okay. So obviously on the helpline, we're asked a lot about all the different healthcare professionals, as we said earlier. Our website has got a wealth of information on all sorts of different aspects, but we have recently made an excellent booklet entitled Getting the Right Healthcare, which we can now point people towards. We can send one out to you. If you ring us on the helpline, we can post that out to you for free. You can order it from our shop free of charge. Or you can just read it online. But we know a lot of people like to have a booklet that they can hold and refer back to and not always be looking online. So this booklet covers all the medical professionals that we've discussed really, and goes into more details about what they do, what you can expect and how to access them. So consultants and geriatricians. So we do get people ringing saying they've only been diagnosed by a geriatrician, but it explains, they are still consultants with special interests in Parkinson's. So there isn't really any difference in that, or a consultant neurologist in terms of your diagnosis. It goes into more detail, as Fiona has a little bit then, about speech and language therapist and physio, obviously, and the different types of occupational therapist, what to expect from a Parkinson's nurse, how to access one. Also, the mental health professionals, it discusses that a little. Mental health teams might be brought in if someone is showing any cognitive issues or dementia, but they also might be referred for counselling, coming to terms with diagnoses and that kind of thing. So it is whatever that patient needs. And if there is a multidisciplinary team, which, as Navina said, is not the case in all areas, but where there is one, it really nicely brings all those things together in theory. So you're not running around chasing all the different professionals. So tips, if you're having trouble accessing these medical professionals, then again, I suppose the only thing I can tell you to do is to call our helpline. GPs can sometimes help, but we all know that it can be hard to get hold of your GP and to get these things moving. So if you call us on the helpline, we can look into where you are in the country, find out from our local people if there are any recruitment vacancies or problems in that respect, just staff shortages, which are meaning you might not get seen as quickly. But we can then, refer you through, as I said earlier, to that local advisor who can not only explain how things are meant to work, but advocate for you with the different medical professionals to try and make that work. So they really are very useful for any sort of problem. We can't always help. We can't wave a magic wand and create appointments when there aren't any, but it is always worth contacting us to see and at least getting some more information and some more advice. And it's also worth noting we do have nurses, Parkinson's nurses, on our helpline. So if you need to speak to a nurse and you either don't have a nurse or you can't get hold of your nurse, you can call our helpline and one of our nurse advisors will call you back. We say within 24 hours. They're not an emergency service. It's not, calling a 999, but they will call you back within 24 hours. And even though they're not your particular nurse, you'd be surprised at how much information and advice they can provide and putting people's minds at rest. And people who may have taken too much medication or not enough medication or are feeling a new symptom that they can't talk to anyone about. It's very helpful for that.
Thank you. And we've spoken about physical activity, but there are some other ways to get involved and maybe find people who also have Parkinson's and get to know them. So could you tell us about some of the benefits of local groups and physical activity groups and where people can find more information about this?
Definitely, yeah. So Being sociable, and I think Ali talked about this very well, and meeting other people, not just to get that physical support, but also that emotional support and the practical advice and information from other people in your local group who are going through the same thing, dealing with the same systems, having the same issues that you are. That is invaluable for that support from other group members. So we do run groups which are just social groups where you can have a coffee. It depends what's available in your area, which I'll come on to in a second. But a lot of the groups that we run are around physical activity. But it's obviously really beneficial, as everyone has just discussed. And we run a wide range of exercise groups all around the country, aimed at all levels. So from seated exercise for people who aren't very mobile, and other gentle exercises like yoga and Tai Chi, to more vigorous exercises and things like boxing and park runs and all kinds of other things that we would point you towards. So there is usually something for everyone. If you happen to be in an area which is quite isolated, either you're very rural or you just don't have transport or anything along those lines, we do have a lot of online exercises and videos. We have a YouTube channel with videos, again, for all different people with the different sort of levels of fitness. So you can access all of those for free, and all our online exercises and videos on our main website. The way to find any of these local groups near you, if you are pretty computer savvy, there is an area on our website which is pretty easy to find, where you put in your postcode and it will tell you any local groups, whether they be exercise or social, and sometimes also groups run by people other than Parkinson's UK that might be of use to you, but we make it clear on whether we run the group or not. So you can do that on the website if you're able. If not, you phone our helpline and they will do that search for you, and they will tell you everything that's nearby. If you would have trouble with access, so say you really want to go to a seated exercise group, but you can't get there, you've no transport, no nothing, we then put you through to our local advisor, because they will know if there are any local schemes that might help with transport, that might help you to get there. Some local groups have funding for it, some don't, so it really does depend on where you live. But our local advisor will do their best to make sure that you do get to any groups that will be beneficial for you.
Thank you so much. I'm going to move on to the Q&A section of this webinar, and we've got a lot of questions that have come through. Some we've already touched on, so we can recap and also add a bit more information. But Fiona, I'll go to you with what level, type and frequency of exercise can ward off symptoms, but also what exercise is recommended?
Exercise is very important, but there isn't one that's better than another, although aerobic exercise does have the greatest benefit on some of the symptoms, but you actually need all different types. You need flexibility, balance, stretching, strengthening, and aerobic. Ideally, you should be doing 30 minutes 5 times a week of moderate to vigorous activity, and then doing some progressive strengthening exercises 2 to 3 times a week, as well as some Parkinson-specific exercises 2 to 4 times a week. So you could be exercising quite a lot, but you can build it into your normal life. The most important thing really is about whether it pushes you outside that comfort level. So it's about your endurance. So a little bit of it's about how long you do it for, but there is some evidence for exercise snacking, where you can do lots of bouts of 10 minutes across the day if you can't face fitting 30 minutes in or more in one bout. But ideally, endurance is important. So how much length of time you do, how often you do it, and how much you push yourself in it as well.
Thanks, Fiona. And Ali, I wonder if you've got anything to add for that as well.
Not really. It's all about that sort of varied diet. And this is what I get in my online classes. It's a varied diet of lots of bits of different things. And having a varied diet means that you don't lose interest. You're not doing the same, plodding along the same furrow for a whole hour. You can be doing, warm up, coordination, strength and conditioning. cardiovascular fitness and balance. I mean, the balance thing is just so important. That's the sort of thing that's really worked for me. But it's getting that varied diet in the thing and keeping the program alive. And also there's a thing about accountability, having a buddy, either an instructor or a partner or a friend, having somebody who you can set targets with and say, well, I want to try and do this I want to try and do the park run in less than 20 minutes. And just reporting back to them and having somebody to keep you motivated.
Thanks, Ali. Miriam, a question for you. And again, I'm going to repeat, we can't give personalized advice when talking about medication, but how does someone find out what the right level of medication is for them?
Well, that is quite a big question that, again, as you mentioned, and you highlighted, needs to be personalized for each individual. But determining the right level of Parkinson's medication is a process that requires quite close collaboration with the doctor, the nurse that knows you, the information that you're giving us. There's so many factors to be taken into consideration. For example, your past medical history, any existing condition, that any already medication that you're taking that potentially may interact, and so on. But I think in general, that we will aim to start the medication regime with a low dose and make sure that you are able to tolerate that with a minimal side effect to nil side effect, and titrate it up gradually. And what will determine to us essentially whether you receive sufficient dopamine replacement is the response of your symptoms. And what will determine to us whether we need to increase that is the story we get from you as to how are your symptoms behaving, has there been any further deterioration, are there any new feature in your management, like how soon when you take your medication that you feel that the medication is working, does it last to the next dose, and if it doesn't, then obviously we need to narrow that gap. So your symptoms will essentially give us a lot of information as to the medication management and the doses required to adjust. And, many times we will choose certain medication that may not be the same one that another person with Parkinson's disease will be taking. Again, it's we try to personalize it because some patients essentially will go on levodopa, but with other group of medications, some patients will be with a caution starting with certain medication, and so it needs to be personalized.
Thanks, Miriam. And Fiona, a question for you. How can I control festination while walking? And for those who don't know, what is festination as well?
Okay. Festination is where when you're walking, you start shuffling and then you find yourself on your toes with your heels in the air. And it's often the thing that happens before you actually freeze and stop. So it's very important to recognize when your heels are not hitting the ground anymore and to stop at that point. Put your heels back on the ground, stand up straight, deep breath, and set off again with a big step. If you don't, it will eventually result in either you speeding up and running, struggling perhaps to stop, or in freezing. And the trouble with freezing is you tend to freeze from the waist down and the top bit of you still going. So you might be more likely to fall forwards. So think big steps as you're walking, steps the size of a ruler, hitting the floor with your heels first can help.
Thank you. We've got quite a few questions physiotherapy related, but what is PISA syndrome? And are you able to chat about how physiotherapy management of PISA syndrome can happen with PD? and how does it respond to physiotherapy?
Okay, so Pisa syndrome is where somebody starts leaning to one side, like the Leaning Tower of Pisa, which is where it gets its name from. And there's a bit of debate as to how many degrees it has to be before it can officially be called that, but it's at least 10%. And the thing about Pisa syndrome, if that is what it really is that when you lie down on a bed, it can be corrected or almost corrected. So the spine hasn't gone into that fixed position. That can happen if Pisa syndrome isn't addressed. But a physiotherapist can help with strengthening exercises, particularly core strength for the trunk, and those big flexibility exercises as well, to try and maintain a better posture and help the body to recognize it's in the middle. In Parkinson's, there can be a bit of a disruption to the sense of your posture being in the midline, and without you realizing you're no longer in the midline. So keeping your general muscles, but particularly your core, strong is really important. So teaching some Pilates exercises can be helpful, or some specific posture exercises, and looking at how you stand or sit. If you're leaning when you're sitting as well, adjusting furniture to help reduce that lean.
Thanks, Fiona. There's a second part to that question, which we'll get back in, we'll address in our follow-up email after the webinar, so we can cover some other questions. But I have a numbness in my left foot, more so in bed. Or could that be related? And Miriam or Fiona, I'll hand over to either of you.
It's a question that needs quite an assessment and more history taken rather than just the numbness. But in general, numbness in food, especially if it's worsened at night time, it's not necessarily a common symptom of Parkinson's disease itself. However, there are a few possible kind of connection. Sometimes it can be related to a condition called peripheral neuropathy, and it does need to have further investigation if that is the case. Sometimes it can be related to circulatory issues, reducing blood flow, like with condition like with diabetes, for example, that can lead to some numbness in the leg, or high blood pressure, or prolonged immobility that can cause numbness, especially at nighttime. There's some condition like nerve compression, like sciatica, or some stenosis in the spine that can lead to numbness. So again, that need to be excluded following a certain investigation. And lastly, there's a condition called restless leg syndrome. This is common in people with Parkinson's disease, and it can sometimes be mistaken as numbness. It can be uncomfortable sensation in the leg, though it's more often like creepy crawly kind of feeling rather than numbness. But one thing is for sure, that if the numbness is new and it's worsening or affecting your mobility, it is very important that you should consult with your neurologist, geriatrician, or your GP to exclude certain condition and try and find the cause for that.
Thanks so much, Miriam. I think we've got time for maybe one or two more questions. And like I said, if we don't manage to answer them today, we will make sure to address them via email afterwards. I still go running, but sometimes get dystonia in my foot. I've been going to a regular yoga class, but struggle with my tremor a bit. Not sure about continuing the yoga. So I guess another personalized question, but I mean, as a general thing, Miriam or Fiona, what would you say?
I can start, Fiona. It sounds to me like great, because you are very active and you're staying active from what you're saying. And dystonia in the foot when you're running can be very frustrating, and different people find different things that might help it. And again, that's why it's so personalized. Dystonia itself can be address and reduce to a tolerable level with optimizing treatment. But certainly it can also be managed with good stretching that Fiona probably can highlight as well on that. But as for yoga, it's understandable that the tremor can be quite challenging with yoga, particularly with certain positions that requiring stillness. I do yoga, and I know I can just imagine how it can affect you. But it all depends. What do you get from the yoga? Do you feel like it helped you in some other ways in terms of flexibility or relaxation? And maybe there's different style of yoga that be more suitable for you. Or I think it's worth exploring with the teacher in the class as well.
Thanks,
Fiona.
Miriam.
Shall I just add that one of the things you can do for your foot for the dystonia is you can roll your foot over a ball or a plastic bottle full of water before you go for a run. Just try and get that plantar fascia stretched before you go. And also calf stretches can help a lot as well. And doing them at night before you go to bed can help as well.
Thanks so much, Fiona. Top tip there. Right, I think it's nearly time for us to wrap up. But before we do so, I'm going to ask each of you, what's one message you want to share for people with Parkinson's? To wrap up this webinar, but anything else that you want to share as well. So, Ali, I'll go to you first.
Well, I'm back to my message of keep moving and finding something that you really enjoy to do, and not leaving it too late. Don't you are the captain of your ship. You are in charge of your condition. Don't wait for somebody else to tell you what to do. Find out what to do. There's plenty of information on the website, that's Parkinson's UK website, that can help you get moving.
Thanks, Ali. Rosalind, I'll go to you next.
I suppose no matter what the issue is, whether it's with healthcare providers and finding information or trying to find appointments or any of the wider things such as benefits and support and other help that's going to help you with your Parkinson's journey, then the helpline is a great place to start. I mean, even if you think we're not going to be able to help, if you can't imagine how we can answer your question, it's a good idea to call us because we can talk things through with you, and we can usually assist people who feel lost in the system. And our local advisors are excellent in their teams and can look into individual problems and advocate for you on your behalf.
Thank you. Miriam.
Well, Parkinson's disease can feel overwhelming, but one thing that it's really important to know is that the individual is not on his own, neither the family member or the friends. Many people live a full, meaningful life with Parkinson's disease, and it's important to take one step at a time, stay active, find good support system that work for you, and work closely with your medical team. And I'm always like to say that there's so much hope for new treatment and research, and focus on what you can do, not just what needs changing. And you need to adjust with this diagnosis. Yeah, that's what I would say.
Thanks, Miriam. Fiona.
I would echo what Ali said, keep moving. And I would say if you need some sort of encouragement to yourself to get moving, then bribe yourself. Do your exercise and then promise yourself a piece of cake or coffee or going out with your friends or something. Give yourself a target and then set yourself something that you can enjoy. If exercise isn't something you think you'll enjoy, make sure you've got something afterwards that you will. And maybe if you're going to go and do exercise, put the clothes out in advance so the decision's made in advance and just get into them.
Thank you so much, everybody. So thank you to everyone who joined. Thank you to our amazing panelists. Like I said, we'll get back to any other questions, and this webinar will be sent to you if you want to watch it back, and will be put on YouTube as well. But thank you everybody for attending.